Being able to obtain quality extended field of view ultrasound images can increase the number of muscles for which we have in vivo fascicle length data.
The main advantage of extended field of view ultrasound is that it can enable direct measurement of longer, curved muscle fascicles, which cannot be captured with traditional ultrasound.
This method may be applied to the over 90% of upper limb and 85% of lower limb muscles with optimal fascicle lengths longer than the field of view of common ultrasound probes.
Successful implementation of this method requires a good understanding of musculoskeletal anatomy, practice obtaining images, and practice assessing the quality of images.
Begin by taking time to become familiar with the systems method for obtaining EFOV-US and with the anatomy of the muscles of interest. After explaining the study protocol, seat the participant in an adjustable chair that can be locked in place and adjust the chair so that the participant is as comfortable as possible while still providing access to the muscle of interest. Place the joint that the muscle of interest spans in a posture that can be controlled and repeated, and use clinical guidance to locate anatomical landmarks. Using the ISB standards for defining the joint coordinate system, mark the anatomical landmarks with a skin-safe marker. Align the center of a handheld goniometer with the axis of rotation of the joint.